Hey doctors, I'm Dr. Brad Watts, and I am with Biogenetix today talking about the support kits that Biogenetix is producing and customizing for your physical medicine clinic. The first kit that I would like to talk to you about today is the Biogenetix Pain Support Kit. This is a kit that we've put together to support your patients that are going through chronic pain and chronic pain syndromes. Under the chronic pain heading, researchers basically divided into a bunch of different subcategories. But as we look at chronic pain, we're talking about something specifically called neuropathic pain. Neuropathic pain is something that is associated with abnormal sensation and pain from normally non-painful stimuli, allodynia. These are your patients that are on opioids currently, your patients that don't respond favorably to typical straight chiropractic adjustments and physical therapy intervention. The reason is that this type of patient doesn't normally have a structural based pain issue. They have more of a metabolic based pain issue. And modern medicine right now is giving these patients opioids, and you'll see why here in a minute, but these opioids are all heroin derivatives. And you can't live on heroin and expect to have a favorable outcome in the future, right? Even morphine or oxycodone, fentanyl especially, any of these derivatives of medical grade heroin. Now, the opioid epidemic is sweeping across the country right now, and unless you've been living under a rock, you've seen some of these headlines that I copy and pasted for you in here. And it's not a good situation that modern medicine has been creating. And one of the things that we want to do is we want to understand why opioids and if there is a natural solution to this. The opioids activate a genetic receptor called an A3AR receptor. When this turns on like a light switch, this A3AR receptor downregulates or dampens pain. It turns it off. And opioids do a really good job of that, and so do some cancer drugs like methotrexate. Now, in this situation, we can't live on those drugs in the long run, but we want to figure out, why does this actually activate this receptor? If you can flip that light switch on naturally, why in the world would you do it with opioids? If we can get to the root of the issue here, you'll see why this works. This is a mitochondria, and not to give you PTSD or anything like that from physiology, but when you take oxygen and glucose, blood sugar, you put it into the mitochondria, you produce ATP. That's this green stuff here. Right? This is energy. We also produce a little bit of exhaust that we'll call free radicals. Over time, as people age and they go through different amounts of stress in their life, their mitochondria don't look nice and smooth like this anymore. They look dilapidated and stressed out, right? Just like their skin. And here's what happens is we produce a smaller amount of ATP and a massive amount of this free radical damage. Right? This free radical damage shuts off that A3AR switch. It turns off the lights. Okay? When you shut off that A3AR switch, what happens is pain shows up. So that means we go from a normal amount of ATP production and a tiny bit of free radicals to a low amount of ATP production and a lot of free radical damage. This is your patient who's dealing with pain. Opioids decrease the amount of pain that the patient's dealing with by masking it. It forces that genetic switch to get turned on, even though this issue is still present, okay? So it clouds it, much like this slide is cloudy on your screen right now, but you can still see that the issue is underneath. So the thing in natural healthcare becomes, how do we get to this root level where we can then vacuum up some of this metabolic dust that you see here, right? This is metabolism, and this is dust. If we can vacuum up this metabolic dust, then we're going to be in business with the patients here. Now, how we do that is by utilizing a liposomal technology, and the liposome looks like a bubble here made out of the same stuff that your mitochondria are made out of, cell wall. We take that cell wall and we inject into the center of it antioxidants, the nutrients that we're going to use in order to vacuum up that metabolic dust. What happens is those liposomes passively diffuse into the membranes of your body, right in the mouth. It gets into your bloodstream, and those liposomes then meet your cell wall, and the contents are spit into the side of the cell here on the inside, so that now all of this antioxidant can go in and suck up all of those reactive oxygen species, right? All of that free radical damage. Very, very cool. What it does is it's basically allowing the antioxidants to clean up the metabolic dust and turn on that A3AR receptor once again. That's what the Biogenetix Pain Support Kit allows us to do. And so in the Pain Support Kit, what you have are 2 liposomal products, the glutathione, which is the chief antioxidant that your body creates. We're not going to wait for your body to create it. We're going to give your body glutathione here. And then also we have GABA, which is going to downregulate the pain receptors and those type C pain fibers. Very cool. Now, in addition to giving you the liposomes that have the antioxidant support in it, we're going to support your body with a product called Super G Antioxidant that gives your patients the ability to produce their own glutathione once again, so that we can go from a terrible mitochondrial situation and move them down the road towards that healthy, happy, and whole mitochondria once again. It's all about flipping that A3AR switch back on, and that's what the Biogenetix Pain Support Kit does.